There's a lot of changes going on in the NHS at the moment, and IT is obviously crucial to those. So I've decided to interview, and he's happily agreed, Mr. Simon Whitehouse, who's our Acting Director of Primary Care here at Central and East Cheshire PCT. We've obviously got a new government, a new NHS. It's all a bit woolly at the moment because we're waiting for white papers, and I think the operating framework came out last week. Where do you see things going IT-wise nationally?
What's becoming increasingly clear, I think, with the new government and the revised operating framework started to talk about this, and hopefully the white paper will put some more detail on, is how responsibility starts to come down more locally. Clearly what they're doing is looking at all the national programmes and not just our national programme for IT and saying, are we getting value for money for that? If we're not getting value for money for it, what does it do, and how are we doing something different with it? Let's not just carry on regardless. So we need to see what comes of that review and what comes as an outcome from that. But if you think that then pushes the responsibility down locally, what does that mean for GP consortia and GP commissioning in terms of IT? If 96% or 97% of the budget is going to be handed across to our GPs to manage and take forward, well, that's got to be absolutely about flow of information. I think the other bit is how do we use some of the new technology, so some of the Web 2 technology, to engage with patients and engage with communities. I think patient panels have a clear role, but I think some of the challenges we've found that we've heard from practices is how do you make that patient panel representative? How do you get the young people engaged? How do you get the schools engaged in that? If you look at the popularity of Twitter, Facebook, all those other types, and whatever comes now from the apps and iPads and everything else that goes with that, how do we make sure that our practices can engage with their communities in a way that's representative and that two-way flow of information?
The current government seems, correctly in my view actually, to be obsessed with outcomes, not process. Yeah. And I think that's going to require a change in the IT systems, really. Have you any thoughts about that?
I would agree in terms of outcomes, and I think that the challenge on that is what do we want to measure to demonstrate outcomes? So are we talking value for money, or are we talking patient outcome? Is that about measuring quality and rather than just saying, yes, we know we've got a waiting list of this length of time, or you've been able to access your GP in 24 hours or 48 hours. Actually, it's less about when you can access that GP, it's much more about when you then have that consultation, do you come out with your care being managed in the appropriate way? I think in terms of how we use IT to do that, some of that I think goes back to even how we educate our students at medical school. So how are we using the video technology, how are we using the video conferencing, the facilities to do that, to help with taking our students in a way of being able to do that reflective learning, much more than just the old medical model of you sit in a lecture theatre and you receive that lecture and you remember that, and then you go out to see a GP in a GP practice and think, what do I do now?
Okay, thanks, Simon. So finally, I think in the sort of new world with GP federations, or whatever we might call them, GPs are going to be interested in managing, or at least performance managing, other GPs if we're interested in budgets. Now, obviously, a lot of PCTs have had experience with this, and you've helped design a balanced scorecard here that's had some good things and some bad things. I wondered if you wanted to just make a few comments about that and some advice to the new organisations.
Okay, I think the challenge with a balanced scorecard or a practice profile is if you set out to use it just as a big stick, then you're setting it out to fail from day one. So you need to understand, it goes back to my answer earlier on in terms of information and intelligence. So what do you want to use it for? What do you want the practices to use it for? And then I think you have to link that to education. So actually, how do you want to use it to educate practices to change behaviour for the right reasons? So what do we do from an evidence-based point of view? What do we know change patients' outcomes, going back to the outcomes answer, and that's what you need to start to pull together. I think it's about education, understanding who your audience is, What do you want to get as an outcome, and how do you turn the information into intelligence to make sure that you can make a difference with it?